इस बीमारी से हम डट के लड़े, ना गिरे ना हारे, हर पल संभल के चले। तैयार हैं हम हर चुनौती के लिए। आओ मिलकर ये कहें,
बदलेंगे हम तो जीतेंगे हम, अब हर मुश्किल we will overcome।
जमाना बदल रहा है, बदलना हमें है, हर एक मंजिल जीतना हमें है।
फ्यूचर करेंगे सेव अपने हाथों से, अब खुल के सपने देखो,
प्रॉमिस करो बुलंद, बदलेंगे हम तो जीतेंगे हम, अब हर मुश्किल we will overcome। बदलेंगे हम तो जीतेंगे हम, अब हर मुश्किल we will overcome।
आओ अब बनाए बेहतर कल, we will make sure खुशियाँ होगी हर पल, हर मोड़ पे संग हम हैं हमेशा, हर प्रॉब्लम को है बस ये कहना।
बदलेंगे हम तो जीतेंगे हम, अब हर मुश्किल we will overcome। बदलेंगे हम तो जीतेंगे हम, अब हर मुश्किल we will overcome।
Namaskar. Namaskar. Today is the 29th of September. 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 Is it good to go now? Go now, 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 Is it fine now? Is it fine now? Is it fine now? All right. These electronic stuff, I think you have to get used to it. Today is, as all of you know, is 29th of September, which is just one day before the month end, one day before the quarter end, and one day before the half yearly end. So why we gathered today at 10 a.m. in the morning? The reason is today is the World Heart Day. 9th of September every year is the World Heart Day. And heart is very important for various reasons. Why is it important, particularly from the medical or from the insurance point of view? We are a life insurance company. So when people come to us, some of them will have to go for medical checkups. And when we go for medical checkups, when the report comes, the people are divided into healthy, that is standard, and substandard. So the maximum reason for people being considered as substandard is heart-related element. Now let us look at people who have got the policy. When it comes to critical illness, that people who claim for critical illness, the single most reason again is heart. When people go for Mediclaim, either from a general insurance company or health insurance company, or even for a life insurance company, of the top four reasons, three are related to heart. One is irregular functioning of the heart, second is heart failure, and the third is blockage. And unfortunately, in the times when claims happen, when we have to pay a claim, the fourth most important reason after cancer, kidney, and liver is heart. Therefore, to have a healthy heart is a precursor to healthy living. So today on World Heart Day, We are privileged to have with us Dr. Snehil Mishra. He is a consultant cardiologist with Hinduja Hospital, and he'll be taking us through a presentation and a talk on healthy heart Hamesha, usually followed by question and answer session. For people who are watching on YouTube and Facebook, kindly post your questions over there, and we shall take it up. If Dr. Snehal is already not covering it in his program, we shall take it up after the program, after his talk is over. So over to you, Doctor. Dr. Snehal?
Thank you so much, Mr. Subhashish. Thank you for your kind introduction. So just a small disclaimer: Kotak is something which is very dear to me. I've followed your company right since its inception. I think a lot of people who would be listening to us today would be part of the Kotak group. I think this has been one of the most wonderful companies in the last decade or two, which has really shaped things beautifully for itself, for the people that it serves. I have recently even become a shareholder of Kotak, so it has been a while that I've wanted to be a part of this group in one way or the other. So thank you so much. I think what is relevant is we are all going through a very difficult time in terms of the COVID pandemic. I hope everyone who's listening to us today is safe and their families are safe. Why this topic becomes more relevant and why we should be discussing this today is not just because it's World Heart Day, but I think besides dealing with the COVID pandemic, we should all also be aware that the essential treatment, the treatment which is the illnesses which are life threatening, should not be ignored. They remain to be life threatening despite the presence of the COVID pandemic. So, although we are dealing with a particular struggle on the corona front, we should not ignore our heart health. We should not ignore our health overall, and make sure that we are aware, as well as bring to the attention of our doctors other issues and other illnesses that we simultaneously are also facing in the country right now. Can I have the presentation, please? Thank you. So I guess in this next 30 to 40 minutes, what we'll be discussing is the various aspects of the heart, starting from what the heart really is, what is it that it does for our body, why is it important to us, what are the different types of heart diseases, what are the reasons for the same, what can we do to prevent them, and what is it that we should know in terms of knowing basic symptoms of heart attack. And finally, how has COVID-19 changed things for us? What is it regarding the heart that we should be aware of, and when should we really need to visit a doctor? Next slide, please. So let's start with understanding what the heart is. Now, how I love to explain this to my patients and to people in general is, let us imagine and assume the heart to be like our house. That's very similar to what it is and what it does, really speaking. So just like the house, the heart is made up of different rooms, different chambers. It is made up of doors and windows which link one room to the other. It has an electrical supply, which is what we call as the rhythm of the heart. and it has a plumbing supply, which is what are the arteries which are supplying the heart. So that's very similar to the structure of our own houses. What the heart basically does is the heart is a pump in the body. That's all that it does, but it's probably one of the most essential functions in the body, because it receives impure blood from the entire body, pumps it back to the lungs, which purify the blood. The lungs return the blood, purified blood, back to the heart, and then the heart sends this purified blood back to the entire body. So this is what that the heart does. It's basically a motor. It's very similar to our house. It's made up of different chambers. The chambers are differentiated or connected to each other with doors and windows, and it has an electrical supply and a plumbing supply, or the arteries supplying it. Why it is important to understand this is because everything that we are going to discuss next is going to be based on one of these factors, and this is what gets affected and gives rise to heart disease. Next, please. So what is heart disease then? Now that we know what the heart is, we would then thereby understand that mainly the three major types of heart disease that we should know of, or we should be aware of, starts from, let's say, the most common, the one which affects the maximum number of people, coronary artery disease, or what is otherwise known as heart attacks or angina. Now, what this disease basically is it just an interruption or a blockage in the plumbing of the heart. So the arteries which are supplying the heart get blocked, get affected, they sometimes get completely closed, thereby damaging a big chunk of the heart, and this is what is called as a heart attack. So that is one subset of heart disease, which is to deal with blockages, which is to deal with heart attacks. The other big subset of heart disease is when it comes to valvular disorders. So these doors or windows that we spoke about, they are connected. So different chambers in the hearts are connected to each other with valves, which allow blood, just like valves anywhere else, to flow from one direction to the other. If these valves become obstructed, or if these valves become leaky, is then what is called as heart valve disease, which is where intermixing of blood happens from one chamber to the other, or enough blood cannot be pushed from one chamber to the next. Now, this is called as heart valve disease. So a big number of our patients suffer from heart valve disease as well. The third most important subset of heart disease is what is called as heart failure. Now, what this basically means is where the pumping of the heart gets affected. Now, the heart is a pump. It is made up of muscles which pump the blood throughout the body, as we discussed. When these muscles weaken, when the chambers enlarge, when the muscles become weak, the heart is not able to pump sufficient blood throughout the body, and that is what is called as a pump failure or a heart failure. And this leads to accumulation of blood throughout the body because it's not getting pushed forward, and which is where a person develops breathlessness, swelling in the body because of accumulation of this blood or fluid that the heart should otherwise have pumped forward. So that is heart failure. The other uncommon but not so rare presentation is with arrhythmia. So what arrhythmias mean is basically irregular heartbeats. Heartbeats can tend to go fast, they can tend to go slow, and that is a disturbance in the electrical supply of the house or the electrical supply of the heart, basically. So these are the four major subsets of heart disease, the common ones at least, that all of us should be aware of. Know what is the difference between a heart attack, a heart failure, an arrhythmia, a heart valve disease. And then there's an entity called as cardiac arrest, which is specifically not limited to the heart. But yes, everyone who dies eventually dies of a cardiac arrest. So a cardiac arrest is the precursor of any death. But what a cardiac arrest basically means is that the heart stops beating. So it's complete cessation of function of the heart. The heart stops beating. It is almost always accompanied with a stopping of breathing as well. So when there is no pulse, when there is no breathing, that phenomenon is known as a cardiac arrest. It's a very serious, the most serious condition that we can have, wherein a person becomes unconscious, collapses, and if resuscitation or CPR is not given immediately, then this would definitely lead to death. So these are the 4 or 5 heart disease spectrums that we should be aware of and know of. Next slide, please. So again, so this slide just encapsulates what we just discussed. Heart disease is of different types, different parts of the heart may get affected, and thereby giving rise to this entire spectrum of diseases. There's also an entity called as cardiovascular disease. Now, this is a wider spectrum. Now, when we talk of cardio, it is in medical terms, it is to do with the heart. When we say vascular, medically what we mean is we are dealing with the blood vessels. So cardiovascular disease is disease not just related to the heart, but related to vessels anywhere in the body. So blood vessels start from the heart and then go throughout in the entire body. So if there is disease, if there is blockage, if there is disruption of these blood vessels anywhere in the body, starting from the brain right down to the toes or the lower limbs, this entire spectrum would then be called as cardiovascular disease. So it's slightly a different entity than heart disease, but then yes, sometimes they are all clubbed together and called as cardiovascular diseases or CVDs. Next slide. Now, when we talk of heart disease, I think this is just a slide for representation purpose, but I think most of us who are living in today's times are aware of what the prevalence of heart disease is, how common it is, how important it is for us to know about it, learn about it. I think in every family, or for at least a close friend, a close family friend, there is someone or the other who either has risk factors for heart disease or has already suffered from heart disease and is undergoing treatment for the same. So I don't think I really need to brief on how prevalent the disease is. It is something which directly or indirectly affects most of us at some point of our lives, and which is why it's so relevant that all of us know about it. Despite COVID being into the picture, despite cancer being a major challenge that we've dealt with for centuries now, cardiovascular disease and heart disease specifically remains the number one killer in the world, and it is number one by far. So the most number of people in the world, in India, die because of heart disease much more than any other reason that we know of. Next slide, please. So common cardiac diseases, again, I think this is something that we've already briefed on when we talked about heart diseases in general. And as we move ahead, I think we'll be talking of the relevant points of each of these diseases again. So we'll skip this. Next slide, please. Let's know about the risk factors. So I'd like to differentiate the risk factors in two subsets, really. I think there are risk factors which most of us in today's times, especially in Mumbai, are aware of. We've discussed them, we've learned of them through various social media and educational sources. We all know that obesity is a risk factor for heart disease. We all know that diabetes, blood pressure, having abnormal cholesterol levels, smoking, having a relatively inactive lifestyle, a sedentary lifestyle. I think these are risk factors that most of us are aware of. That we may still not emphasize on them, that we may still not control them is a different aspect altogether. But I think there are certain risk factors about heart disease that are by now very well known. The people are aware of it. People know that eating oily food, people know that having diabetes, having blood pressure, smoking causes heart disease. Smoking especially, I would like to emphasize upon. A lot of people feel that smoking only affects the lungs. Nothing can be further from the truth. Smoking for me is one of the strongest risk factors in my young as well as relatively elderly patients. So smoking not just causes cancer, not just affects the lungs, smoking or tobacco in any form, so to say, it is a very strong risk factor for heart disease. It affects blood vessels throughout the body. So that is something that we should know about. But I think the known risk factors are now known to most of us. Family history, again, something which is quite relevant, plays a very important part. Despite there being no other risk factors, if there is a strong family history of heart disease on both the maternal, that is the mother's, as well as the father's side, there is a very strong chance that we may suffer from heart disease ourselves as well. Next slide, please. But what I think especially in today's talk, what is very relevant for us to know, and this is something that I have seen in my practice only over the last 5 to 10 years, especially in the last 5 years, a majority of my patients now, so more than 50% of my patients who come to my clinic, who are getting treated by me, who are suffering heart attacks or getting angioplasties, bypasses done, are less than 50 years of age. And this is a trend that has remarkably changed over the last 5 to 10 years. Now, previously, we used to have children bringing their parents to us for checkups, for getting them treated, for getting an evaluation done. Now it's exactly the reverse. Now it is the parents, and I really have to wonder who the patient is when two people walk into my OPD or clinic. And this is something that we should really know about. This is something that is affecting the real workforce of the nation, the 30 to 50, 55 years age group. Heart disease is no longer common only in people who are above 60, 65 years of age. And let us know what are the reasons for heart disease, which we should know about in the younger generations. Next slide, please. So we've already briefed upon the common known risk factors: diabetes, hypertension, dyslipidemia, abnormal cholesterols. But there are certain things which we are all living with, but unfortunately we are not aware that these are also issues which are affecting our heart, our health, our bodies, our lives in general. Now let's talk about the first and the most important thing: stress. Now, unfortunately, it is very much a part of our lives. Most of us who are working, most of us who are dealing with family pressures at the work front, are aware that stress is as good a part of our life. What we should know, however, is that stress beyond a particular limit is not normal. It should not then be accepted as a way of life, as a part of life. And unfortunately, there are no tests to measure stress yet. It's not like sending a blood sample, knowing the values and knowing, yes, how stressed out I am. And which is why a lot of times it gets ignored. A lot of times it gets taken for granted. And I think for today's day and time, as many people as are suffering from probably diabetes and hypertension and abnormal cholesterol, and equal if not more number of people are also dealing with abnormal stress in their life, and this is definitely a killer. So although we can't measure it, although there is no way to know what is the actual level of stress in our body, but when it starts affecting our sleep, when it starts affecting our day-to-day life such that we are not able to enjoy the simple things in life, I think it has started affecting our health and body and heart in general as well. So stress, all of us should be aware, should not be taken or accepted as normal or as a way of life, especially if we think that it is affecting our sleep or health or our day-to-day well-being. So please get it addressed. Please cut down. Let us think more long term. Let us think of achieving, and this is especially for the younger generation, the people I see in their 40s, 45s, over ambitious, I must say, trying to achieve more things early, shortcuts, too many things to be done from the workplace, multiple family issues, so many things which contribute to stress. But let us start addressing them. Let us start identifying them as problems which affect our health and body, and not just as something which we have to live with. Next, sitting is the new smoking. I think this again is very, very relevant and important for all of us to understand. There are various slides, demonstrations of this, but for our generations, especially the ones who've had everything on their seats, starting from mobile phones, the world is now online. We barely need to move. We can shop online. We barely need to move from our seats really to do anything, most of the things at least. And this is what is contributing to a lot of ill health. It's not even about having a 30 to 40 minute gym session. That does not compensate for moving throughout the day. In fact, there are now apps which encourage us to move every half an hour. If we are sitting for prolonged periods of time at our work or at our homes, we are predisposing ourselves to heart disease and having an unhealthy life in general, as much as smoking. So sitting for prolonged periods of times, not moving around, affects us as much as smoking. Please let us identify this and understand that this is also a risk factor for heart disease in general. So make sure that if you're having meetings, you're having these meetings, especially if they're going to be prolonged, with a part of them at least with everyone moving around. Try to walk while you're talking on the phone. Try to make sure that there are breaks every hour or so when you get some 5 minutes to move around and come back to your seats. This is something which is extremely, extremely relevant. And please understand that just going to a gym or just having a walk of half an hour or 40 minutes does not mean that you can spend the rest 12, 16 hours in the day sitting at one place. Again, reversal of sleep pattern next. This is something very, very frequent in my young patients. A lot of people are keeping awake at night for work reasons or otherwise, and thinking that they can compensate for the sleep by sleeping in the daytime or in the afternoon hours. Now, for a lot of my young patients who apparently have no risk factors, their blood reports are normal, the moment I ask them about their sleep, I get an obvious reason to what is causing their problems. People who are working for BPOs, people who are in the film industry, people who are developers who are working for companies abroad, who have to have, and especially when done for a prolonged period of time. So an occasional night out, obviously, the body copes up with it. But for people who are Uber drivers, like for example, who drive only in the night, these are people, when they continue to disturb their sleep pattern of morning and night for a prolonged period of time, they invariably suffer from heart diseases, is what I've realized. Sometimes this may not be recognized. So you may get even treated for heart disease, and the real cause may not get identified if we are not aware of what the sleep pattern and the reversal of it is doing to our bodies. Sleep apnea, again, when we are discussing of sleep. So although snoring by itself, if it is mild, may be benign, but snoring, when it starts disturbing the sleep, when it starts causing daytime drowsiness, is not normal. So a lot of people who may not otherwise also be very obese, but which are slightly on the overweight side, especially if they have excessive snoring, and if this snoring is affecting their peaceful sleep and causing them to be drowsy in the daytime, I think this needs to be brought to the attention of your doctors. We should know of there being an entity called sleep apnea, which is a major contributor to both blood pressure, sugars, abnormal cholesterols, and definitely heart disease as well. Again, normal weight obesity, these are terms that we don't really hear of. These are terms that the media also unfortunately does not highlight much, but we think that the BMI is all that we need to know about. If our weights are normal, then we are supposedly healthy, but unfortunately for us in India, it doesn't work that way. There is a very well known medical entity known as normal weight obesity. What it means is that although our weights are normal, we tend to put on a weight or fat around our waist. We have more abdominal circumference, Indians in general, as compared to people in the West. And so, despite apparently looking as having a normal weight, despite apparently having a not so high BMI, we may tend to suffer from what is known as normal weight obesity, or obesity which predominantly affects the abdomen, the abdominal circumference. And this kind of fat deposition around the waist is very, very unhealthy and makes us as prone to heart diseases and health related issues as for someone who may be overall obese. So very important for us to understand this. Now, again, when Mr. Subhashish and I was just having a discussion the other day, we did discuss that a lot of people who come to him, a lot of people they review in life insurance or general medical insurance in general, are people who have issues because they've started rigorous physical activity or marathons, as is often the fad, or go for treks. Any rigorous or unusual physical activity started without a good physical preparation, without a good cardiac preparation, or without an optimal cardiac screening, is a very strong risk factor for developing heart related events when these activities are done. So we find people who collapse during marathons. We find people who get affected when they go to high altitudes. A good chunk of these people have not been adequately trained for doing these activities and have not been ideally screened for heart diseases before they perform these activities. So I think this slide is extremely important. All of us, especially in the younger age group of less than 60 years of age, should know not just about the common risk factors, but about these which are affecting us on a day-to-day basis, and make it a point to address these. Next slide, please. How to identify symptoms. So let us now know what are the common. Now we know of what is heart disease, what is the heart, what are the common heart diseases. We know of what causes heart disease. Now, if it unfortunately affects us or our close ones, how do we identify the symptoms of heart disease? Next slide, please. So I think chest pain is something that I don't really need to elaborate upon by media, through Bollywood, through TV serials. Most of us are now aware that yes, if someone has a heart attack, he would clutch his left side of the chest and there would be extreme severe chest pain. What I need to emphasize upon in this talk is that often and in a good number of patients, chest pain may not be the presentation of heart disease at all. And these are the patients who get missed. These are the patients who who get diagnosed late, who don't present to us when they have complaints. So let us know what are the features of heart disease besides chest pain. And let's start with shortness of breath. So breathlessness sometimes is mistaken as just having related to having a higher weight. Sometimes it gets mistaken as lung disease. Sometimes it gets just mistaken. For my elderly patients, their relatives feel अभी उम्र हो गई है तो इसलिए सांस फूलती होगी. Please let us understand that breathlessness, shortness of breath, especially when it is exertional, when it happens after say a prolonged walk or after climbing stairs, may not just be a normal phenomenon. It can very well be as much a sign of heart disease as chest pain is. And when we talk of breathlessness, I simultaneously would include fatigue and tiredness in the same frame because it's very difficult to differentiate between these two at times. But a lot of unusual fatigue, along with or without breathlessness, tiredness, especially on exertion and which gets relieved on rest, is very much a sign of heart disease, often as much as chest pain is. The other common symptoms are palpitations, so an increase in an awareness of one's heartbeat, dizziness, feeling of a virtual blackout in front of the eyes is again a marker of very serious underlying heart disease. Knowing these things, it is also important that we know that swelling in the body, as we discussed in the heart failure discussion, can also be a sign of heart disease itself. I think these are plus minus most of the major signs or symptoms that my patients come with. So they come with chest pain, they come with shortness of breath, tiredness, unusual feeling or awareness of the heartbeat, giddiness, cold sweats. Now again, sweating may sometimes be excessive for people, which may be a normal thing. But sweating so excessive that it makes the person's body feel cold is often a very strong warning sign. So cold sweats, giddiness, having swelling all over the body, all these signs are or symptoms are as much a manifestation of heart disease as is chest pain. So let us know not just about chest pain, but about all these other entities as well, and bring it to the attention of our doctors if we or our close ones are suffering from it. Next, please. What are the early signs of heart attack? Now, I think again, this is something which I really believe, given the state of heart disease, given how big a killer it is, and this is something that I really believe should be a part of the school curriculum. This is something as much as cardiopulmonary resuscitation, all of us should know what happens during a heart attack, and a big chunk of it is what we've already discussed. Now we all know about the left-sided chest pain, but please also understand that a lot of times, especially in women, in elderly patients, in diabetics. Now, these are the common three subsets. So, women who are after their menopausal age, people who are elderly. By elderly, I mean people who are more than 75 years of age, or the ones who are long-standing diabetics, who have diabetes for a long period of time. These are people who, despite having a heart attack, may not apparently have a lot of chest pain. So we'll come to distinguishing between acidity and heart attack in some time, but please let us be aware that definitely, so chest pain, a feeling of heaviness, a stone kept over the chest is one of the commonest signs of a heart attack. Often it is accompanied with extreme sweating, perspiration, a feeling of impending doom. So the person feels that the world is about to end. Now these are the classical signs of a heart attack. This is unmistakable. If something like this happens, this is often almost always brought to the attention of doctors or to a hospital. Or what is missed though are things like having extreme acidity. They get mistaken as just being related to gas or heartburn. Having unusual breathlessness, having unusual tiredness, all these, especially when the person himself or herself feels that no, something is not okay with me. Now this is a very vague term, but I've often realized that the patient's body has told the person that there is something wrong. This is not usual. I am not feeling okay is often one of the first things that they realize, and this may then be followed with any of these signs of chest pain or breathlessness or an extreme heartburn or acidity, very unusual sweats, a feeling of giddiness. All these that we've discussed as symptoms of heart disease can be the signs of heart attack. We should all be aware of them. And now, next slide, please. We should also be aware that if these happen, what is it that we should really do? Now, before we discuss how to treat a heart attack or what should we do, and as non-medicos, as if we are not cardiologists, what is it that one would need to do? Let us also know the differences. And this is again, so like I see a lot of young people who come to me with heart disease now. I think uh, at least 70-80% of my patients who actually have a heart attack initially mistake themselves as having gas or having acidity. They get self-treated with eno, or they call up at times their family physicians who in good intent but ask them to take over-the-counter antacids, and thereby they come to the hospital, and finally it does not get resolved, and they often come to the hospital quite late, when we lose these golden hours when we can really give them the maximum benefit of getting treated with for the heart attack that they actually have. And which is why it's important for us to understand what is acidity, what is a heart attack, and what are the things that we as non-medical people should be aware of to distinguish between these two entities. Next, please. So why is it that these two often mimic each other, and that we'll know when we know what they really are? So this is just a slide to say what the definition or what these two entities really are. Heartburn or acidity that we know of is when the acid contents of the stomach. Now the stomach has a lot of acid because it needs to digest food. When these acid contents from the stomach regurgitate back or get thrown back into the food pipe, which lies right in the center of the chest, that sensation or that phenomenon is known as heartburn. Now, there is a valve, just like there are valves in the heart, there is a valve which connects this food pipe to the stomach as well. And when this valve tends to become leaky, or when it allows the acid to come back into the food pipe, is when there is a feeling of heartburn. And it's a misnomer, it has nothing to do with the heart, but it's called as a heartburn because, as we will now know, be it the left side of the chest or be it this food pipe which is located right in the center of the chest, their locations are very similar, and which is why often it's so difficult to for us, if we are not doctors, for us to understand whether this discomfort that we are having is really from the chest or the heart, or is it just a heartburn, because their locations are similar, and which is why these two entities often get mistaken for each other. Next, please. So what is it that then we can know, or what is the so-called red flags that someone who presumably has acidity should know of? We should all know of these things, especially the ones who are suffering from acidity. But I think everyone now, again, as much as knowing heart attacks, knowing the differences between acidity and heart attacks, I honestly believe should also be a part of general education for every one of us. So let us know what these red flags are. Acidity that worsens during exertion and becomes better with rest is almost never acidity. So what seems like acidity, what feels like acidity, but if it worsens with exertion and gets better with rest, this is almost always a sign of underlying heart disease. Now, acidity that wakes one up from sleep or happens in early morning hours, again, is one of the biggest red flags. If someone tells me this, or I get a call of someone who apparently has suffered from acidity but has woken them up from sleep, or has happened only in the early or morning hours, this is almost always never simple acidity. Acidity which is accompanied with breathlessness, giddiness, unusual sweating or cold sweats that we discussed should also not be ignored to be only acidity. An acidity which is unresponsive to previous medications, or which is more severe or lasts much longer than before. Now, this is something that people who suffer from chronic acidity or acidity for a long time are often aware of. They know which medications give them relief, and they know how long does their acidity usually last. Now, if those same medications are not giving them relief now, or if their apparent acidity now lasts much longer or seems much severe than what it ever has been, I think that is not something that should be ignored. And these so-called acidities are very often heart diseases which get mistaken as acidity or heartburn. And we should all know of these red flags and bring them to the attention of our doctors when we go to them. Next, please. However, unfortunately, although knowing all these, it may not sometimes be as straightforward and simple even for us as cardiologists. So it's often not apparent just by talking to someone or just by checking the pulse and the blood pressure of someone to really conclusively say that, yes, this person has a heart attack and this person does not have a heart attack, and this person only has acidity or something else. And which is why often when we go to a hospital, when we visit clinics, we may need more than just a history or just an evaluation of our symptoms and a basic examination to really come to a conclusion of what is a heart attack and what is not, and what are the various investigations or tests that one needs to do it to make sure that we are differentiating these well. Next, please. So I think starting from the simplest, almost everyone who's gone to a hospital ever with chest pain or with a suspicion of heart disease knows that this strip that I've shown is something called as an ECG. It is basically a representation of our heartbeat. So the electrical rhythm of the heart gets reflected in this paper strip that gets taken out. And this is one of the simplest, and for us as cardiologists, getting an ECG done is something as probably important and frequent as measuring the pulse or blood pressure of our patients. So it is the simplest test, one of the most basic tests available almost at most reasonably equipped hospitals, and one of the first things that anyone who has a chest pain gets done. What we should although know about an ECG is that an abnormal ECG and an ECG which is showing fresh changes or which had no changes, which was normal before and has now become abnormal, definitely is a marker of heart disease. But there are heart diseases, a good chunk of them, which may have an absolutely normal ECG at rest as well. So an abnormal ECG definitely means that there is a problem, but a normal ECG may not always exclude heart diseases. So again, because a lot of my patients feel, हमने तो ECG करवाया था, it was normal, so obviously it means that we don't have heart disease. Now, unfortunately, it's not as simple as that. The next most frequent test that is done, especially when we go with acute chest pain to an emergency room of hospitals, is a blood test called as cardiac enzymes. This is again something that is very commonly done. These markers go up when there is a heart attack. So an abnormal cardiac enzymes almost always means that the person has a heart attack. So blood test, ECG, this is the bare minimum, the most basic tests that are done in any emergency room when a person comes with a suspicion of a heart attack. Next, please. Then there are the slightly higher variants of the tests that are done. So 2D echo, something that a lot of us may have done during our routine evaluation, or something that we as cardiologists do for our patients with heart attacks. It's basically a sonography of our hearts, tells me the structure of the heart, the pumping of the heart, the function of the valves, a very important test to diagnose heart attacks as well as know about the complications of heart attacks, and also if any coexisting issues in the valves or in the chambers otherwise may also simultaneously exist. Treadmill test, or otherwise called as a stress test, very commonly performed in routine screenings. We are made to run on a treadmill, and simultaneously the ECGs are recorded. So a lot of heart diseases may have a normal ECG at rest, but these ECGs tend to become abnormal when the patient's demand increases, that is the heart's demand increase when they perform an exertion on the treadmill, and which is where the ECG becomes abnormal. Next, please. The other two are the cardiac CT angio and the coronary angiography. These are the highest tests that one may need to do for final confirmation or exclusion of heart disease. CT angiography now is very commonly available, very commonly used by a lot of us for patients who have borderline symptoms. We are not too certain. We need a test to be really 100% sure. CT is a good test to do. And a coronary angiography. Now, this is myself doing this procedure. So this is something that we do as the gold standard. So finally, if heart attacks are to be treated immediately or for final exclusion or inclusion of heart disease, I think the gold standard is to do an invasive coronary angiography, wherein a catheter is taken up to your heart. We inject contrast or dye, and we can actually visualize the arteries of the heart and be certain that whether there are any blockages, are the arteries flowing well or not. So this is the gold standard. This is the final test that helps us prove or disprove and simultaneously treat as well a heart attack if it were to occur. So I think these are the 5-6 tests that all of us should at least know what these mean, when is it that they may be needed. And these are the ones which are commonly performed when you reach a hospital with chest pain. Next, please. So before we come to prevent, I think the only thing that we've missed out on is what to do if someone has a suspicion of a heart attack. I think if most of us who are listening to this talk are from cities, are from Mumbai, especially, I think for me, what I tell everyone, in fact, even family physicians who may not have adequate facilities at their clinic is, uh, just learn how to identify what the red flags are. Just learn when to suspect that someone may have a heart attack right now. Don't ignore that. Don't mistake it for acidity. Don't mistake it as just unusual sweats. Just know how to identify it and rush to the closest hospital at the earliest. So what we should really be aware of is know how what a heart attack may present as, besides just having left-sided chest pain. We should know what the emergency number of ambulances close to us are. We should know which are the closest hospitals relevant to where we are at work or at home, where we can rush our closed one or friend or relative or ourselves if one were to suffer from a suspected heart attack. And we should know the basics of resuscitation. Now, cardiopulmonary resuscitation is a different talk in itself, but one should understand that CPR does not treat heart attack. CPR treats cardiac arrest, which is a final manifestation of a heart attack. So if someone develops a heart attack and collapses, becomes unconscious, that is, and the breathing stops, the heartbeat stops, that is where giving CPR really has any benefit. CPR by itself is not a treatment of heart attack. So you can have basic medications at home. People think keeping a sorbitrate, a commonly available tablet below their tongues can help. Yes, these are temporary measures. But I think what helps the most is reaching the closest possible hospital at the earliest, where an actual evaluation and the actual treatment of a heart attack can really begin. Unfortunately, it is not a simple disease to be treating at home or to be really managing at home such that we don't need to reach a hospital at all. So all that you need to know is know when to suspect a heart attack and know what the emergency numbers are. And if you are suspecting yourself or anyone close to you to have a heart attack, please rush to the closest hospital at the earliest. An ambulance is ideal, but unfortunately, we don't live in an ideal world, at least as far as medical facilities are concerned in our country and cities. So at times, an ambulance may take time to reach us. And if that is the case, then preferably we should rush the patient in our own personal vehicles, though that is not recommended, but that is sometimes the resort that we have to fall back on to. If we are transporting a person who is suspected to have a heart attack, please do not make him or her climb downstairs or walk for a prolonged distance. Please make sure that an arrangement for transportation, even from the house up till the vehicle for this particular person, is made. And I think this is what is more relevant for us to know and do, rather than know about which tablet is to be given, which pill is to be given that can really delay or help in heart attacks. I think as non-medical people, as people in the general population, what we should know is how to identify it, and if it is identified, when and how to rush the person to the closest hospital. I think this is what is important. Next, coming to how to prevent. Next slide, please. Again, most of what I have written here, most of what I may even describe is not something that we really don't know. I think, again, for like the common risk factors of heart disease, most of ways of prevention of heart disease are things which we are all very well aware of. We all know we should avoid unhealthy food. We all know we should avoid smoking and tobacco. Keep alcohol in moderation. We all know we should eat healthy. Previous slide, please. We all know that we should get ourselves screened for heart disease. Now, just a touch on screening of heart disease. I think everyone who is above 40, especially for males, and everyone who is above 45 for females, should ideally have a basic routine screening, which includes the heart. If not every year, then every couple of years for sure. So this is something that I feel that all of us should do. Just so that we are aware of our numbers, just so that we can identify risk factors at an earlier stage and treat them if they need it to be. And anyone who has a strong family history of heart disease may need to get screened off much earlier. So even at 30 years of age, for example, for people who have a very strong history of heart disease or heart disease at a young age, they may be screened for heart diseases or for abnormal lipids, cholesterol and diabetes at a much earlier age group as well. But I think so being active, avoiding a sedentary life, living stress-free, inculcating yoga or meditation in our day-to-day lives, having more raw foods, including a lot of dry fruits in our overall consumption. I think most of what is on this slide is something that we are already aware of. I think the problem in terms of prevention is not in awareness. The problem is in doing what we already know. So knowing is not doing, right? Doing is doing. And I think that is where the problem is. Most of us are aware of these things, but hardly any of us are really doing any or all of these things the way they should be done. So I think the emphasis should more be now on doing what we already know, rather than just keep trying to find out if there is a magic formula that can really prevent heart. There is no magic food, there is no magic berry, there is no magic preparation that can really forever prevent heart disease. There is no such elixir, unfortunately. These are the simple things that all of us know about, but unfortunately they are simple but not easy. That is how they are, and probably which is why most of us are not practicing them, and thereby we are seeing the prevalence of heart disease as it is right now. So again, the only other thing common which I think gets discussed is which oil, how much oil. I think the recommendation now, and I again, so emphasizing more that the quantity of oil is much more important than which oil are we going to use eventually. So any oil, if it's going to be a 5-liter can, like is the convention for most of our families, is going to be eventually harmful for us. Indian foods especially tends to be very high in carbs, very high usage of oil in our preparation, at times salt. We have low protein in our diet, and we have high carbs. And this probably is responsible for a good chunk of diabetes and heart disease that we are seeing. So try to reduce the carbohydrates in our diets, try to increase the protein intake, try to limit the oil consumption to as low as possible. Rice bran oil is said to be one of the healthier ones. Changing our oils, alternating between say a rice bran and a groundnut oil and a mustard oil is presumably healthier. But I think again the emphasis is more on the quantity of oil that we are finally going to consume, rather than which is the best one that we can consume in large quantities. Unfortunately, there is no safe oil, really speaking. Olive oil is safe, but is used only as a preparation, as a dressing over salads. Olive oil, when used for cooking, may not be as healthy as it apparently seems. So these are the things as far as oil and diet and overall prevention I think that we should know about. But I honestly feel all of us know about these things. It's more that we are not doing them rather than we are not knowing them. Next slide, please. So again, so we all know heart is the core of our body. For someone whose heart is healthy, it eventually leads to a healthy body as well, because most things that are needed to keep a healthy heart are eventually things that keep the body in general healthy as well. So most of these factors would help us to fight or prevent cancers. Most of these would prevent kidney disease. Most of these would prevent us from stroke. So I think if we are doing things to keep our heart healthy, we would eventually keep our body healthy as well. And that was really the topic, and this is what we are here to discuss as well. Next, please. So when to see a doctor? Now, just this last slide and discussion on COVID and its implications on the heart and how it has changed things for us. So I think COVID has changed things both for good as well as for bad. The good has been that yes, a lot of people now have become probably more aware of their lifestyle. They are trying to live healthy to boost their immunity, but in a way then also emphasizing on their health. We are all relying more on digital platforms. So a lot of my patients who had to travel a lot for my visits are now availing of teleconsultation. So it's made their lives relatively easier. We are all having gadgets at home now which can help us to know our blood pressure, know our pulse, know our oxygen. So we've become a bit more aware of our health. We've started valuing our health, I hope, a bit more than what we did previously. So that's one of the good things. Some of us who have the option of working from home are getting to spend more time at home and with our families. So there are good things about COVID, but unfortunately the bad things are far too many. So one subset of COVID is the fact that it affects the heart by itself. So corona can cause heart attacks as the first presentation without any apparent fever or cough or breathlessness. Corona can cause blood clots throughout the body, affecting not just the heart, but the lower limbs, the lungs, the brain. Corona can also affect the heart muscles and give rise to heart failure at that time or during a post-recovery phase. So especially the people who've had serious COVID infections should be aware that they can have heart failure as a presentation in their recovery. So if they feel breathless, if they feel unusually tired, if they have swelling in their body, they should make their doctors on follow-up aware of these things and get screened for heart failure. So these are the three relevant things about corona and heart disease directly. But I think indirectly as well, what it has done is it has made us miss so many heart attacks in these last 6 months because people are apprehensive to come to hospitals. It has made us miss so many dangerous illnesses which are as prevalent and relevant to us in today's times as they were in the pre-corona age, so to say. So what I really want to tell everyone who's listening to this talk is that COVID can have a mortality. Yes, you may go to a hospital despite all our measures and eventually contract a COVID infection. But the mortality of COVID is just 3 to 5%. It's not just, but it's still 3 to 5%. While the mortality or the chances of dying because of missing a serious illness like a heart attack or like a cancer or like a heart failure or like having an abscess in the body and not getting it treated is much more higher than the risk of dying because of even contracting a corona in the hospital. So if you or your near ones or if your friends, anyone, if they have serious issues which need to be identified and treated, please do not feel that you should not visit a hospital or COVID is such a big threat that we should keep ignoring our symptoms for a very long time. This is something that is going to stay with us for the foreseeable future. So let us pay attention to our other relevant diseases and other relevant lifestyle issues simultaneously along with fighting with COVID as well. So this is all that I wanted to brief everyone on. Thank you very much for your patient hearing. And if there are questions now, Mr. Subhashish and the team, I'm more than happy to take them. Thank you.
Okay, I realized I was on mute. Thank you very much. And we've got quite a few questions which we need to ask you. Of course, some of the questions you already covered. Okay, first question that there is what's the link between blood pressure and heart? So what's low blood pressure and what's high blood pressure, what you call hypertension? And added to the question, some people have asked is that they have been on medication for high blood pressure, but it's always quite high, 180 by 100, and that's what it is, not able to control. What is to be done for these things?
So, Mr. Subhashit, let's talk about what is normal blood pressure first. I think there is a range. So, what we should all know about is this number that we are aware of, 120 over 80, is not an absolute number in itself. So, when we in medical terms talk about blood pressure, we talk about it as a range. So, that range can exist from as low as say 100 to up to 130 in certain patients, even up to 140. But I think 100 to 130 is the range for us for the systolic or the higher blood pressure, and around 70 to 80 to almost 90 for the lower blood pressure is the range that we are looking at when we are describing normal blood pressure. So that is one part to understand that, and which is why, so someone who has say a blood pressure of 110 over 80 men or 110 over 74, as one of these digital gadgets may show, may not necessarily have low blood pressure, and there is no reason to panic. So blood pressure is a range, it's not an absolute or a fixed number. One point. The other point is blood pressure also tends to fluctuate in a normal healthy person throughout the day. So it's our normal body response to lower the blood pressure when we are sleeping or when we are at rest, and it's a normal body response to increase the blood pressure when we are agitated or when we are anxious or when we are doing a physical activity. So this is a normal body pattern, and often then, so if you are really measuring your blood pressure when we are stressed, if we are measuring our blood pressure just after doing an exhaustive physical activity, the blood pressure may tend to be higher than normal, but that is a normal phenomenon. That is something that the body is normally doing to compensate for our activity or for our stress. So this is something that we need to understand. Now, as far as what should people do who are 180, 100, I think that is what medically is for us called as resistant hypertension. One is obviously the emphasis for all of my patients who come to me let us emphasize as much on lifestyle as to medication. So I make sure that lifestyle is being addressed. I make sure that they are inculcating yoga or stress relieving measures in their day-to-day life. Things like sleep apnea that we discussed are often missed in patients who have resistant hypertension and they continue. So what people feel is they just see the blood pressure and they feel that they only need to take tablets and control this. Unfortunately, that's not all that it entails. It also entails lifestyle. It also entails identifying reasons which may be contributing to that blood pressure, and then finally visiting a blood pressure specialist or a cardiologist to know whether the treatment that we are on, the medications finally that we are on, are they in the right dose or are they in the right combination for us as well. So I think all three of it is important for people who have uncontrolled BP, identifying if there are any other causes that are causing that blood pressure, as emphasizing on lifestyle, and then coming to the medications and trying to change, increase, or add medications as may be required.
All
And
right.
can blood pressure, is it related to the heart and heart disease? Definitely it is. It affects blood vessels throughout the body, and then definitely the blood vessels supplying the heart as well. So it is definitely one of the very strong risk factors for heart disease.
All right. The second thing is pulse rate. So there are, again, there's a understanding that 72 is the per minute is the right pulse rate, but some people have low and some people have very high.
So
Apparently, there's nothing on the face of it that shows they're ill. So what is the what's the thing around pulse rate? What would you advise us for people who have, let's say, a 50 pulse rate and somebody who's got persistently around 100 pulse rate?
So again, pulse rate is more a range, Mr. Subhashish. So it's 60 to 100 is what we define as the normal range of pulse rate. Again, 60 may not be absolute, 100 may also not be absolute. So one or two beats lower than 60, one or two beats higher than 100 is no reason to panic. But what this number of 70, this number of 120 over 80, this was just identified as a number because 80-85% of the general population had their values around this number. So this is how these normal, so-called normal numbers were defined as. But there is a good chunk of population who has a lower than 70 pulse rate, and there is a good chunk of population who are always in the high 90s when in terms of their resting heart rates as well. Now, in terms of lower pulse rate, I think I really start worrying only if my patient's pulse rate start dropping below 55, and that is not when they are at sleep. So just like for blood pressure, when your body is relaxed, when your body is sleeping, it will have a lesser heart rate than what it is when we are active or awake. So one is, these are not during sleeping hours, but in awake hours, if someone's pulse rate despite being on no medications is less than 55, is when I really start worrying for my patients. And when their heart rates are persistently more than 110 or 115, or when someone has an abnormal awareness of their heartbeats, is when I start getting worried about the rate per se, the number per se. Now, as far as having high heart rates is concerned, I think a lot of my patients who have high heart rates are usually the so-called type A personalities, which I'm sure even in your spectrum of people and friends and corporate world especially, you would identify the ones who are aggressive, ambitious, too competitive, want to make sure that everything, the perfectionist, there's so many adjectives that one can emphasize them to have. So these are usually the people who would seldom have heart rates in the lower 70s. They will not have a heart rates in the 60s to 70s, and a lot of these are benefited a lot with yoga, meditation, and stress relaxation techniques, and without medications as well over a period of time, and definitely regular physical activity. So most of these people are usually, they live a sedentary life, and they are very stressed out overall in general. And when we identify and treat these two issues, they tend to have much lower heart rates and they tend to do much better. So I think that should be really the emphasis. So if the heartbeats are getting unusually felt, or they are more than 110, 115 on a consistent basis, or less than 55 in the awake hours, that is when I think one should really be worried. Otherwise, it's normal to have a heart rate in this range.
Okay, so here's a question from Mr. Jitesh Joshi. He's asked a question, seems to be a technical question. Does gaining VO2 max make heart healthier?
So it does. I mean, so now we are talking. These are things that so people who work in cardiac rehabilitation with us, when we have a separate subset of our treatment known as rehab. So patients who suffer from heart attacks, patients who have an angioplasty done or a bypass done or who have heart failures. There is a separate entity called as cardiac rehabilitation. There is a separate entity called cardiopulmonary exercise testing. Now, VO2 max and exercise related oxygen and activity parameters are parameters which are judged there. And in over a period of time, the emphasis is to make sure that these levels are optimized to as much as possible in an individual person. So definitely optimizing the VO2 max is an indicator and a target for us to make our patients' heart healthy overall. But what people in general should know is that as your endurance increases, as your ability to perform more and more aerobic activity for longer periods of time increases, your heart rate does not. So VO2 max may be a technical medical term that people who are specializing in exercise physiology or who are specializing in rehab really measure and target. But I think in general terms, what I've seen is that as the ability to perform aerobic activity for longer periods of time increases, as the heart rate tends to remain normal for longer periods of time despite performing physical activity, that is almost always an indirect indicator of the VO2 max also increasing and the endurance and the overall heart health increasing. So in simple terms, if one is able to perform longer periods of aerobic activity with relatively controlled heart rates, that is an indicator of VO2 max. And for people who are specializing in exercise physiology, it is definitely a target for our patients to be achieving.
Thank you. The next question is from Mr. Subramaniam, who is saying, what routine tests should be done after the age of 50 for heart?
So, Mr. Subramaniam, now again, very good that you brought this up. Unfortunately, during the discussion, I didn't have time to elaborate on this. So there are two components when the heart is concerned. One is the blood test, because we all know that we should know our values. We should know if we are suffering from diabetes and abnormal cholesterol. So these are the two basic things that our blood tests help us to pick up. So one is getting the routine panel of blood tests done, which should include the testing for sugars as well as the testing for cholesterol. Now I'm being specific only to the heart here. Coming to tests besides the blood test, I think a common misconception, the way it is being sold, unfortunately, by my own fraternity or for diagnostic labs, and is that they give the packages, give our patients the choice to choose between a 2D echo and a stress test. Now this, I'm sure, Mr. Subhashish, for most of you who are dealing with insurance and for most of us who go for health packages in a particular hospital or lab, there are packages which say आप choose करो, आपको 2D echo करना है कि आपको stress test करना है. Now knowing so much about the heart that we've discussed, I think it's important for us to understand that these are not optional tests. Ideally, for a complete evaluation of the heart, one must undergo both a 2D echo and a stress test. That is when the evaluation of the heart is complete, because the 2D echo is only looking at the heart at rest, only looking at the structure of the heart, while the stress test is making sure that the function of the heart is good when it is being stressed or when it has to perform a level of activity. So both these tests, if the patient can perform a stress test, that is, both these tests are ideally needed. Let's say if someone is having a low risk for heart disease and is starting early, then I may think of doing these tests only once every 2 years. For someone who is above 50 years of age, who's above 55 years of age, or for someone who has a strong family history or a strong risk factor history for heart disease, I would tend to do both the echo and the stress test and these routine blood tests even once every year. So I think what we should know is, do the blood test, do both the 2D echo and the stress test, except for, say, very elderly or patients who are obese or who have knee issues who may not be able to do a stress test. Then there are other tests which are probably beyond the scope of discussion, but there are other tests that can still test for the function of the heart that could possibly be done. But for most of the general population, as a general advice, I think both 2D echo and stress test along with the blood test, once every 2 years if the age and risk factors are on the lower end, and once every year if it is on the higher side.
Thanks a lot. lot. Ashish Russell wants to know what is the ideal waist circumference?
Now,
And is
so
it different for men and women?
it is. So I think what we are targeting for men is around 36 to 38 inches in terms of waist circumference, and anything which tends to go above 36, so to say, for us starts falling in the unhealthy range. This is for men. And for women, the numbers are lower. So 32 to 34 is what we are looking at in terms of women. 32 is where we want to be, and 34 is ideally the highest that we should tolerate before we start advising medications and other aggressive measures. So, and then when we know these numbers, and then when we compare to the actual waist circumference of the population in general, we would know that so many of us tend to have waist circumferences higher than this, and then thereby, despite having normal, apparently normal weights or BMIs, we may still have a strong risk factor for heart disease. So 36 and 32, and 38 on the higher side, say 34 on the higher side for women.
Okay. Ramesh Bhalera wants to know how to differentiate between chest pain due to a heart attack and due to a muscular pull.
So, Mr. Balirav, I think in general, the golden rule that we all apply in our clinics as cardiologists is anything that if for any symptom, so for even if a patient, like I said, even for acidity, even for breathlessness, and then for chest pain, any symptom that gets it comes through, or it is more apparent when someone is exerting and is better when someone is at rest, is something which is very strongly associated with the heart. So the heart tends to, so this is a demand supply thing. The arteries which are supplying the heart, if your demand is not high, the same supply may be sufficient. When the demand increases, when the heart has to beat more number of times or has to work harder, the same supply may not be sufficient to meet this demand, and which is why we have this angina, or which is why we have this chest pain. So any chest pain which is worse on exertion and better on rest is almost always related to the heart. And any chest pain which has no relation to exertion, which is present throughout the day, in fact worsens more on lifting the arm, in fact which seems to worsen more on compressing on that particular side, these are atypical chest pains. These are often muscular, these are often bone related chest pains, unless and until it is a chest pain which is accompanied with one of those very dangerous signs. So if a chest pain is accompanied with excessive sweating, if a chest pain is accompanied with giddiness, unusual uneasiness, a feeling of not being well at all, that is an exception. But otherwise, in a normal feeling individual, chest pain, if it is worse on exertion and better at rest, is to do with the heart. Chest pain, which is throughout the day and seems to worsen more by moving the arms and more by compressing at that side physically, is likely to be a muscular chest pain.
Okay. Diksha Desai wants to know what are the symptoms of angina and what can the family do to give first aid till help arrives, or we able to remove the person to the hospital?
So, as I discussed, I think I briefed upon this, Mr. Subhashish, but anyways, coming to it again. So, one is, as far as angina is concerned, this is what we should know. Angina is basically chest pain, which is related to the heart. Almost always it is chest pain which will get increased on exertion and get relieved by rest. In a heart attack, though, it is even at rest, and it is accompanied with all these danger symptoms that we've discussed. There is our knowledge and transporting the person to the hospital, I'm saying this again, is actually the best first aid that we can do. There I can talk of tablets here, I can talk of blood thinners here that can be given to patients even at home for that matter, but unfortunately they need a particular level of medical knowledge. They need you to be certain that our patient is having a heart attack, and there is no way to be certain until and unless an ECG can be done. So I think the bare and unless someone has had a cardiac arrest, then the first aid is to give cardiopulmonary resuscitation. But as far as heart attacks are concerned, as far as angina is concerned, so there is a tablet called sorbitrate, which, if kept below the tongue, relieves the chest pain. It relieves the chest pain, but it is not a treatment for the heart attack. It does nothing to the heart attack. It just makes the patient feel a little better so that he or she in the meanwhile can be transported to a hospital. But let that not be mistaken as a first aid, because it is not doing so. It's just like a simple painkiller for the headache. If I have a tumor in my head and I take a painkiller and it relieves the pain, it does not mean that I'm doing anything to treat my tumor. So that is how this sorbitol tablet really is. It just makes the person comfortable for a few minutes, 15 minutes, half an hour, till he or she can be tried. But it can't really be called as a first aid. What is real first aid are the blood thinners that I, as a cardiologist or someone who has the idea of what is to be done, can really do. But for us in general, as a general population, I think our first aid is our knowledge of knowing when to suspect a heart attack, when to know that this can strongly be a heart attack, and then to immediately, without thinking of giving first aid ourselves, without wasting time on arranging for first aid, that often leads to losing precious minutes. In a heart attack, the first 30 minutes are the most crucial. If I advocate giving first aid, bringing for first aid, keeping even first aid at home, but trying to administer it, waiting for its effect to happen, I think we'd be losing precious time. I think if you can call an ambulance and the ambulance can reach you within 5 minutes, that's the best first aid. If not, then do not wait even for an ambulance. Take the patient, try to transport the patient safely up to a personal vehicle and take him or her immediately to the closest hospital where at least basic treatment for a heart related ailment can be given. I think that is the first aid. That knowledge and transporting the patient to the hospital at the earliest is the real first aid rather than any medications or pills.
It's a very important. It's a very important point that you made. I think most of us are not aware of it. We probably think that we see those films where we try to give CPR and do all that things. But I think
So
it's a very
these are
important
the
point.
common mistakes. This is what I have commonly seen. I think 90% of people, they would expect that as the answer from me, and they get very disappointed when I don't give them that answer. But I am not here to please anyone. I'm here to tell you what should really be done. That is what should be done. It sounds simplistic, it sounds disappointing, but frankly, that is the reality. There is no first aid that you can really give to dramatically change anything. The best first aid is to rush to the closest hospital and let the cause be identified and let the treatment be initiated.
You spoke about sleep apnea. So Rajendra Rausekar wants to know how to overcome sleep apnea. What does the doctor do if you are diagnosed with sleep apnea?
So sleep apnea actually is not treated by mostly it is not treated by us as cardiologists. So there are chest physicians and there are ENT specialists who tend over a period of time also become sleep specialists. But sleep apnea, so it again starts with the lifestyle. A lot of the causes for sleep apnea are to do with the neck. So there is an excessive deposition at times of fat in the neck, which tend to obstruct the airway passage, and this is what causes the sleep apnea. So losing weight, maintaining a healthy lifestyle is one of the initial targets and one of the initial advices. But the actual treatment of sleep apnea in most cases is by a machine called as BiPAP or CPAP. So these are machines which have a mask and they push air with a lot of pressure and thereby helping to overcome this obstruction in the airway passage. So patients who suffer from sleep apnea, which is more than moderate to severe, they have to sleep with these machines on, and using these machines, I've seen this in my patients over a period of even a few weeks, has given dramatic results. So my patients' cholesterol has become normal, their pressures have become controlled, their sugars have become normal, and just because this was not identified as a cause and treated. So there are these airway pressure machines that these patients use, and then the final resort is surgery. So if despite using these machines, the patient is not responsive, or if the doctor after examination feels that there's actual an obstruction or an alteration of the anatomy of the airway tract, starting from the nose down, that needs to be modified by doing a surgery, then surgery may be needed as well. But in most cases, it is treated by using either the pressure airway machine or by starting with simple lifestyle measures. So that is the treatment of sleep apnea.
Okay. Usha Ramchandani wants to know, do you recommend garlic 2 paws to control blood pressure?
So it goes like this. I think so. Again, alternative therapies. I come from, despite being a cardiologist and trying to do what I can in modern medicine. I come from a background of family members who practice alternative medicine. I have homeopaths in my family. I have people practicing Ayurveda in my family. So I'm not saying that these things do not work or these things should not be used. I think what we should try and do, so garlic, if it is, just let us not be under the false belief that using them all the time is all that is going to help us control blood pressure or cholesterol. So garlic is not just, in fact, garlic is more known to control cholesterol levels or to act as a mild blood thinner rather than to be known as controlling blood pressure. So blood pressure, it has a role, but not as much as in cholesterol or being a blood thinner. So be it garlic, be it any of the other alternative therapy things that we may be advised for or we may practice, I think they are just a usual overall component of leading a healthy lifestyle in general. I am not against my patients using garlic, and if eating garlic, or say two chunks of garlic in a day, or ginger, happy to keep them off pills. So I've always told my, especially the ones who get diagnosed for the first time, I often strongly advise them to refrain from taking where to draw the line. Let us understand that yes, if we've done what we can in our overall lifestyle, there are certain issues that need the help of medications. Like I have spectacles. If I continue to resist using spectacles, I'm only going to do more harm to my body than anything else. So when we know that we've tried something, if it has not helped us, if it is causing, there is evidence of it causing harm to our body, let us then not feel. And medications which we now give, especially for things as blood pressure is, they are very safe medications when taken lifelong as well. So if we need to be on medicines lifelong, even, it is better to be on them rather than to keep attempting other alternative measures just on the pretext that we do not want to take medicines. So that, I think, should be identified and should be known. Otherwise, trying garlic, trying alternative measures, trying yoga, and making sure that we are using it to control our blood pressure or sugars or heart disease is not a bad idea, but it is not sometimes enough in a good number of patients. And then we should not have the apprehension of not taking modern medicines or not resorting to modern treatment at all. And also, these should be used or given only by people who are really trained and know what is to be given and given. So knowing, the alternative therapist should also know their limitations, know what is genuine and what is not, which unfortunately in that particular stream is not a very common phenomenon. I mean, so there are gray, black sheep everywhere, but then the number of people who are quacks who practice alternative medicine, but they really don't know what is to be done, is much more than what would probably be in modern medicine. So that should be identified and known. That's all.
Okay, here's a question by Anjana Saini. She wants to know how antioxidant water and alkaline water helps prevent heart disease. Does it?
Now, again, honestly speaking, I am not aware of anything which has really been done in terms of thousands or millions of patients or people in general. So what we now rely on in modern medicine is, we call it as evidence-based medicines, right? So we conduct a scientific trial. We divide people into two groups: the control group and the treatment group. The control group, like for alkaline water, will not receive the alkaline water. The treatment group will receive it, and we will follow these people up over a period of say 5 to 10 years in sufficient numbers. So not just testing 50 people here, 50 people there for something which is to be applicable to an entire population. We can't test it for 100 people. Let us test it for thousands of people in one group and the other, and then actually compare the effects of what we are claiming to be helpful over a period of the next 5 to 10 years. Because unfortunately, the effects may not immediately be apparent. These are slow progressive diseases. So for the effects we actually follow these. I am not aware if and such an exhaustive trial or a study has actually been conducted on something like alkaline water. I'm aware that it is, so a lot of issues in the body are said to be because of overall acidic nature of the blood or the body in general, and the alkaline water supposedly neutralizes this effect, and thereby it is helpful. So the concept is interesting, the concept is nice, but has it actually proven to have the advantages and the benefits that it is claimed to have? I don't think it has been proven. So for me to really suggest that as a measure is difficult. But I think all these things, if you can do it, do it. But the emphasis, so I think what increases, frankly speaking, even personally, Mr. Subhashish, I think what increases the acidity of the body is the overall stress that we are living with, the overall inflammation that happens in the body because of our stress and unhealthy lifestyles is what is making our bodies acidic, so to say, frankly.
Mhm.
And then the better way to control it is then to target the stress and to live a healthy lifestyle rather than ingest alkaline water, as far as I can understand and imagine. But if someone wants to have it, is monitoring for other adverse effects that the alkaline water can give, having periodic blood checks, and doesn't mind spending on it and thinks that, okay, it is probably going to be helpful, and if it doesn't harm, then I might as well take it, fine. But has it really been scientifically proven in large numbers to give all the benefits that it claims to have? I don't think it has been proven.
I think, Doctor, one interesting thing and one important thing I would say that you are stressing again and again is ultimately go for what is finally giving you result. If after doing all that, if you're not getting result, then do consult a proper allopathic doctor to see. Before that, do whatever you want. But yeah, you gave the example of spectacles. After doing any kind of exercise, if you still require spectacles, you'll have to go for that
Absolutely.
spectacle. You
Absolutely.
can't be in denial.
Absolutely. And so all of us, I think, who've had used spectacles have been in denial for the first few months. Everyone who's had spectacles, everyone, I think, at least 9 out of there, only a minority who really want to have spectacles at the earliest. The majority are initially always in denial. But we know that after a period of time, we realize that no, we are just fooling ourselves by living in denial, and we need to use this lifelong, and we accept it and we start using it. So I think the same goes, and these are just I'm talking of a very simple example as again something which can be life threatening. Now the unfortunate part of, so I'm as much a believer in lifestyle and alter, and I think a good chunk of my lecture I've kept talking of lifestyle, stress, live healthy, control, do yoga. So I'm as much a believer of alternative therapy, if it is to be called that, or lifestyle, as much as I am of modern medicine. But then, as I said again, it is to know where to draw the line. If we think that just alternative medicine is going to be helpful in every individual and even in controlling illnesses as severe as heart attacks or heart failures completely, then we are just fooling ourselves, and then we are doing grave injustice to millions of people who suffer from them and continue to be misinformed by these WhatsApp videos or these internet videos about how just doing a particular treatment can completely cure them of heart disease or diabetes or any other chronic illness, so to say. And so many patients continue to suffer and worsen because of these so-called unproven claims and fallacies. So these people are not doctors. They are actually quacks, which are just propagating misinformation, which is easiest to propagate. So dog bites man is not news. Man bites dog is news. And so that is why this is what becomes popular, although that may not be the general rule. So this is how it really works, Mr. Suresh.
Anil Verma is asking an interesting question. He's asking two questions actually. First is, why do heart attacks usually come in the morning? The second question he's asking,
I'm sorry, Mr. Subhashish, I missed the last part of the question.
why do heart attacks normally come in the morning?
Yes.
The second question he's asking, extreme sorrow and extreme happiness sometimes results in heart attack. What would be the reasons for the same?
So I don't know if it's coincidental, but the reason for both, the answer for both the questions is the same. So even when I spoke about acidity versus heart attack and the red flags, I especially emphasized on the fact that if it is acidity which is happening or very severe in the early morning hours, apparent acidity, or which is awakening someone from deep sleep at night, that is often not acidity, it is actually a heart attack. And the reason, not just heart attacks, but it is heart attacks and strokes or paralytic attacks. Both of them tend to be much more prevalent in the early morning hours as well as during winter seasons. And the reason for it is that, so there is something called as a sympathetic system in our bodies. which tends to peak at these times. So how it works is that the body actually at that time is trying, so normally around 5 o'clock, 6 a.m. in the previous eras at least was the time for people to wake up, for hunters to start going on, or farmers to start going to their farms. So around 3 to 4 a.m., 4:30 a.m. is when the sympathetic drive in the body actually starts picking up. So the body actually starts preparing itself to become active now in the next half an hour to 1 hour, 2 hours time. And that is when the sympathetic activity goes up. And that is where, so when I mean sympathetic, it causes a constriction in the blood vessels, it causes an increase in heart rate. So your body is just trying to prepare itself to become more active now. Wherein in a person who has already diseased vessels, sometimes this sympathetic activity may increase beyond a particular limit, thereby giving rise to a heart attack or stroke, and which is why they are so common in the early morning hours, and which is why anyone who comes with any symptom early in the morning, 3 a.m., 4 a.m., reaching the hospital, we have almost a golden rule that we tell to our juniors or people managing the ER that if someone comes at 3 a.m., 4 a.m., never send the person back home, because this is often the time when disastrous things like heart attacks and strokes commonly present, and we should always be overcautious in these people. So the sympathetic overdrive is responsible for these early morning or winter heart attacks, as well as for the events that happen during extreme grief or extreme happiness. So again, it's that sympathetic overdrive, that entire increase in both heart rate as well as constriction of vessels, that gives rise to these issues.
Thank you. We had a lot more questions, but we have really had a very interesting 90 minutes. We don't know how it went. I really enjoyed myself. I'm sure you would have enjoyed yourself too. And quite a few things that we take for granted, you've opened our eyes to few of the things. So for people who have asked us more questions, we'll be replying back to you individually, because we nearly have to let the doctor go. You know, it's a working day. He has to go back to work in addition to whatever time he has been spending with us. So for all people who have logged in, thank you very much. And Dr. Mishra, thank you very much for your time.
Thank you.
And we'll continue to have more such sessions on Badlaav Studio, which is our platform for change. Badlenge hum, jeetenge hum is our war cry. As the situation world around is changing, everybody needs to change. And this is the first, actually, the program that we have on this, on the platform that we have created called Badlaav Studio. Thank you very much, Dr. Mishra. And thank you, everybody, for watching in early morning on a working day. Thank you, everybody. Goodbye. Take care. Be safe.
इस बीमारी से हम डट के लड़े, ना गिरे ना हारे, हर पल संभल के चले। तैयार हैं हम हर चुनौती के लिए। आओ मिलकर ये कहें,
बदलेंगे हम तो जीतेंगे हम, अब हर मुश्किल we will overcome।
जमाना बदल रहा है, बदलना हमें है, हर एक मंजिल जीतना हमें है।
फ्यूचर करेंगे सेव अपने हाथों से, अब खुल के सपने देखो,
प्रॉमिस करो बुलंद, बदलेंगे हम तो जीतेंगे हम, अब हर मुश्किल we will overcome। बदलेंगे हम तो जीतेंगे हम, अब हर मुश्किल we will overcome।
खुशियाँ होगी हर पल, हर मोड़ पे संग हम हैं हमेशा, हर प्रॉब्लम को है बस ये कहना,
बदलेंगे हम तो जीतेंगे हम, अब हर मुश्किल